Well, workers' union NEHAWU says it will embark on a total shutdown if their demands are not met. The protest action is in line with the union's National Day of Action. NEHAWU says as frontline workers, members in the healthcare sector do not have adequate PPE. They are also demonstrating over a wage increase and against the corruption allegations with regard to COVID-19 funds and contracts. Yesterday, NEHAWU held a motorcade in honor of members who had died in line of work. The union has also held lunchtime pickets in the lead up to the National Day of Action. Reporter Lerato Fekisi has more from Port Elizabeth.
Well, in Port Elizabeth, NEHAWU has come out in full support of its medical staff throughout the country that is fighting a pandemic with not enough PPEs. But that seems to not be only the problem that they're facing. They also have stated that they are also fighting against a lack of salary increases, some that was promised to all the health workers in April this year, but to date has not been done. This is all happening at a time where there is currently debate and talks around corruption around PPEs. So NEHAWU is saying, how can it be that the people fighting the pandemic on the forefront are struggling with basic things such as PPEs, yet there are people within political structures receiving huge amounts of money and in terms of corruption in regards to PPEs. But joining me this afternoon is also part of this day of action by NEHAWU is NEHAWU Regional Chairperson Sandile Mpepo. Sandile, let's just talk briefly about this afternoon. Why was it important for you to stand in solidarity with your workers, especially at a time now where there's so much corruption surrounding PPEs?
Thank you very much, and good afternoon to your listeners. We're here because one of the things we want to do today, we want to draw a line in the sand with our government. We're worried about this country because when we took government to court and said there is lack of PPEs in our hospitals, which we deem to be the battlefield of what we were fighting for with regards to COVID-19. Our government said they went to court and said what we are saying is not true. There is enough PPE in the country. But we are standing here today and we have lost about 240 frontline workers. And we are taking offense because it seems that government is not taking that serious. And as NEHAWU are saying, this government also released about 500 billion to assist in the plight of our workers with regards to PPE. But we have seen there is a huge list of corruption around the PPE tenders. Now, we are putting that squarely on the doors of government because we are saying it is clear to us that their lives that could have been saved had monies be spent in the right way. So we are saying, we are blaming the deaths of our members and those of even the ordinary people of our country, those that were in the care of our nurses, of our doctors. We are saying there are those that we could have saved had we made sure that government listened to us and made sure that there were proper processes to ensure that the monies that were released and the budget that was given was actually spent properly. And we are calling upon them to say all corrupt officials that have been found to have stolen money that was supposed to defend the lives of South Africans, we want to see them in orange overalls. And number two, we are taking offense because our government, when we came to the front and said in the bargaining chamber, these workers are in the line of danger, they are in the line of defense in the country. What is it that you are going to do? We said we are demanding that they must be given a danger allowance. Government spit on us on the face. They never gave a mandate to go to the bargaining chamber and discuss that these workers are in danger. Now we're saying today, it is clear that these workers were in danger because we've lost about 240 frontline workers. You see, so it's not something that can be disputed. Now we want to understand what is it that they are going to do about our workers who have sacrificed their life to defend this country. Because one of the reasons we are now talking about we have reached the peak, numbers are going down, we have a 96% of a recovery rate, is because of these frontline workers. So we are saying, where is the appreciation? But beyond that, you would remember that we have Resolution 1 of 2018. Now, these workers were supposed to receive their salary increments in April this year on an agreement that was taken. When we said we want an annual agreement, they said they wanted a 3-year agreement. We agreed. Now they are backlacking. It is these same workers who are not being paid now. Their salary increases, and they have worked throughout that. So we are telling them today that failure to come to the table and resolve this issue, we are going to take all our power out, and we are going to the street, and we are going to continue towards the full-blown strike that is planned by now.
Mr. Mpepo, you're obviously working with workers on the ground. You're speaking of a recovery rate. Eastern Cape numbers are going down. But what is the real issue? What are the real challenges still facing workers despite the recoveries, despite the numbers going down? When you speak to workers, are they still struggling with PPEs? Are they still struggling with things they struggled for in the beginning when the COVID-19 virus started?
Of course, what is happening now is that testing is reduced and people are being turned away. That means that hospitals are no longer full and COVID-19 patients are no longer in the hospitals, and most people are being sent to recover from home. But one of the things that members on the ground are saying is that why did government not take a decision to actually renovate our hospitals to deal with the plight of COVID-19? Because today we are faced with municipalities who are now closing down venues that were housing COVID-19 patients, and we are left with no leakers. We are still left with vandalized hospitals in Torangins, vandalized hospitals in Livingston, even in UPH. And we are saying this 500 billion that we are talking about, part of making sure that whatever happens in the future, we should be able to be ready to defend our people and make sure that our workers are safe. We are not prepared for that.
Mr. Mpepo, also the issue of COVID-19 also speaks to in terms of adhering to regulations. Here it looks like there are over 50 people. Was there no another alternative you guys could have taken to protect your workers, or was this the only option you had because you've been trying so hard to get through to the government but nothing has been done?
Well, one of the tricks that are involved in this thing is that there is this number of 50. But again, as workers, we do have a constitutional right to strike. But if you look around here, you will see that as NEHAWU, number one, we've taken a decision to provide PPE. We've given our workers this mask that you see I am wearing today. We've given them this sanitizer that I'm showing you. And all of them are sanitizing, they're wearing masks, and they are sitting in groups unless when we are addressing. Now, this is the only way we could have shown our force, because we've tried in the bargaining chamber. Government is delaying the processes of engaging and finalizing processes that affect these workers. And we have said this thing that now we are prolonging everything is not working, because obviously we are not the decision makers, but we are negotiating with them, but we can see that they're playing a game with us. And we're saying it is time that we take things into our hands. You will remember that Texas took a decision to say they are no longer going to follow the regulations. They did what we are doing here today, and they were actually, the president responded and gave them what they want. So it seems in this country, in order for you to be listened to, or for government to give you what you want, you must then do what is in your best interest and forget about other things. But as I'm saying, we are in a safe environment here. You see I'm wearing a mask, we've distributed sanitizers, and we are not going to be here for long. But we have sent a statement to say if this call of today is not listened to, then government must know that we are heading for a full-blown strike. Whether or not it is allowed, we are going to do it in the same fashion, and that is how we will deal with our issues moving forward if they fail to resolve the issues that we're facing with.
Very angry and frustrated regional chairperson of NEHAWU, Sandile Mpepo, saying that for a long time they've been making a plea to government, number one, to improve the issue of salaries of medical staff, and it still hasn't been done. Number two, they've been demanding proper PPEs to go to clinics and hospitals. That's not been done. So they're saying, although the regulations say they shouldn't be having such a peaceful march, but they say there is no other way for them to be listened to because they've tried everything to no avail. And they say that should their demands not be met through a memorandum that's been handed over over in Bisho to the Oscar Mabuyane, the Premier, and also around the country, various government officials. If that's not answered within 7 days, they're going to complete shutdown of the country in the name of protecting their workers against a virus which they say is dangerous, and at a time where their workers need enough PPEs.